Good afternoon, and thank you for joining us for our second Swedish Facebook Live today. We are Swedish, and we're a healthcare system in Washington State, the largest nonprofit in Washington State, which includes 5 campuses and 115 clinics, as well as 2 freestanding emergency departments. So we in Seattle were on the forefront of when this pandemic hit us, and so we thought it would be great to be able to broadcast live to you on Facebook and get your questions and answer them real time for you, because we know the facts are changing daily, the situation is changing daily. So thank you for joining us today. With us is a panel of 3 of our experts. I have our CEO, Dr. Guy Hudson. We have Dr. Kate Mandel, who is in the ICU, and we also have Dr. Goldman here, who is our infectious prevention disease expert. So I want to start out a little bit with just introducing yourself to the audience.
Absolutely. It's good to see you again. I'm Dr. Guy Hudson. I'm the CEO of Swedish.
Oh, I'm Kate Mandel. I work in the intensive care unit, and when I'm not doing that, I'm also a surgeon.
Hi, I'm Jason Goldman, infectious disease consultant.
Great. And so, Dr. Hudson, I wanted to start with you. So please, again, comment, send in your questions, and we'll try to answer them real time. But I want to start with Dr. Hudson, as week by week it changes really quickly. So give us an update on how this week has looked.
Absolutely, Mona. Happy to chat. So, by the way, thanks for joining us again. It's been a busy week, I would say. We've seen a lot of things transpire over the past week. You've been watching the news as well as in seeing how the United States is affected by the coronavirus, especially with, our hearts go out to our colleagues in New York City and other cities who are experiencing just an escalation of the pandemic. But we've also seen this escalate, albeit much more slowly, in the state of Washington. So looking where we are now, the governor has issued the stay-at-home order, and for those of you who are watching, please, it makes all the difference in the world. If you wonder what your part could be in this and how you could help not only your families and each other, but also healthcare systems weather this storm, staying at home and doing your part makes all the difference. Hand washing, gelling, all those things make a difference. And from the bottom of my heart, I can't thank you enough for following those. In regards to the healthcare systems just in Puget Sound, including Swedish, we have seen the volume somewhat plateau. We are optimistic and we hope that this holds. But again, in order for us to continue forth without seeing a peak in cases with runs on the healthcare system, your job is just as important as our job in really helping us keep this pandemic, mitigating it under control with your physical distancing and your part. So that I want to say thank you for, but again, it is critically important. Don't let up on that, please.
And this week also, I think the governor appointed a COVID czar.
Yeah, so all the healthcare systems in the state are tied in to potential escalation and planning if hospitals need to step up or if we get a flood of sick people coming into the healthcare systems. We're all connected through the state efforts, through a lot of those agencies to help us not only understand our preparedness, but also keep us communicated and coordinated in a fashion to deal with that potential emergency. Governor Inslee is now working with a partner, Admiral Bono, from the Navy, who is very well versed in this type of emergency events and response. And we're very lucky to have her on board, and she has been quite the fine addition to the team in regards to that coordination efforts if we were to need that type of emergency response.
That's great. And Dr. Goldman, I want to turn to you. You're our resident expert today on COVID-19. What is the latest information out there that you can tell our Facebook audience about?
Yeah, so thanks, Mona. We, as Dr. Hudson said, we're seeing escalations in the epidemic in various parts of the country. COVID-19 cases are in all 50 states now. And even though initially Western Washington and the Seattle region were the epicenter of the US epidemic, our rates of rise here have been a little slower than in some other regions of the country. We're not exactly sure why this has occurred, but perhaps it's due to the excellent physical distancing and the decisive actions of our public health and government officials. In other parts of the country, like New York City especially, I personally have family there, and I know that the crisis they're experiencing there is very severe. As everyone knows, New York is in closer quarters, so it might be harder to do physical distancing in those settings. In terms of the disease and the possibility of treatments or vaccines, we're still holding out hope for those, although there's nothing definitive at this time. Here at Swedish and across the Providence Network, we're actually testing a lot of different potential treatments which may or may not have efficacy in this disease. That said, we still don't know exactly if those are going to be efficacious, but we're holding out hope for that. And there are no more updates in the vaccine realm. I know there's been lots of questions about that, but that's still a number of months away, maybe even up to a year or more.
How long does it normally take for a vaccine to be developed?
Yeah, so the time course on development usually occurs over at least a year or more. There's some newer technologies like RNA vaccines, which are accelerating it to some degree. So there's been actually a phase 1, which is a safety study started by our colleagues right here at Kaiser, our partners in healthcare, where they're testing a vaccine already in people. But the process of getting that to market is still many, many months away.
Okay. And the burning question I've seen all over the media is really about ibuprofen. Like, should we not use ibuprofen? Is it hazardous if you have COVID?
Yeah, great question, Mona. There's been a lot in the news and in the media about ibuprofen, especially in Twitter. The sort of Twitter sphere has exploded with questions about ibuprofen. So far as we can tell now, there's no scientific evidence about nonsteroidal anti-inflammatory drugs like ibuprofen, about the effect on disease progression of COVID or worsening or mortality. What we know is that there's been some what seems like bot activity where tweets are sort of sent in an automatic way, sort of heightening the fear associated with this very common symptomatic treatment for people with fevers. So it actually got picked up by some prominent public health experts, including the Minister of Health in one European country. But the World Health Organization has noted officially that there's no scientific evidence to guide us here, and they do not prohibit or recommend against the use of non-steroidal anti-inflammatory drugs like ibuprofen to help patients who are suffering from fever or other symptoms from COVID-19.
So your advice is?
My advice is that you shouldn't hesitate to use symptomatic treatments, which is really the standard supportive care for COVID-19. Tylenol is a great choice, and also ibuprofen is not proven at this time to be harmful in COVID-19.
So one thing I would add to that is just everything in moderation. So make sure that you're taking Tylenol, ibuprofen as prescribed and safely, and not taking additional amounts in an attempt to treat yourself.
Yeah, and actually, Dr. Mandel, I was going to turn to you next. And really, you're on the front lines in the ICUs. What's the situation these days in our hospitals?
So we're definitely slowly seeing an increase as these patients are coming into our ICUs. We know that for the small portion of people who do get the more severe form of the illness with severe respiratory distress, it can be a more prolonged course in the ICU. And so these patients are starting to slowly fill the ICU, although as Dr. Hudson said, it has not been as rapid a rise as we thought here. From our perspective, it's really standard ICU management. We've been doing ARDS management for a long time, been treating people on the ventilator for a long time, and our strategies are the same for this illness. So similar to supportive care in the mild forms of illness, in the more severe form of illness, supportive care in the ICU has really been the cornerstone of our management.
And it's great having people here that are on the front lines taking care of patients. And by the way, I can't thank you enough. One of the things that we've seen just improvement in, even in the past week, is the capability of testing. And just the ability, we've worked with a lot of local partners regarding testing as well as laboratories, but having on-site testing for us is a big deal and something that we could really have a rapid turnaround to get people the right care at the right place at the right time and continue our mission. So can you just speak to those capabilities?
Yeah, sure, Dr. Hudson. So, initially in the pandemic, testing was a major impediment to making the diagnosis. Testing was limited to certain people who are symptomatic or very symptomatic. That bottleneck has reduced quite a lot. Testing was authorized by the FDA, so lab-developed tests, like the one that was developed by our colleagues at the University of Washington, is now available and at scale. So our testing delays have shortened from about 4 or more days down to about 24-hour turnaround at this time, which is great, and we can get it in near real time and make the decisions that we need to do clinically for supportive treatments or adjunctive treatments, or even offering participation in a clinical trial to help us understand what treatments might work for this disease.
Yeah.
And I know there's always confusion and frustration with the test results taking so long to come back out there. And so I just want to go over the basics again. Like, if you think you have these symptoms, what should someone do?
Yeah, so if you have symptoms that are like fever or upper respiratory tract infection, runny nose, sneezing, or especially cough or shortness of breath, those are things that should prompt you to first call into your primary care doctor's office. Your primary care doctor can help advise you best on what the next steps are to take. Not everyone can interpret their own symptoms perfectly, but doing that in conjunction with the clinic nurse or the clinic provider is really helpful to know what to do for the next best steps. Here at Swedish and really across the region, we're really expanding on our telehealth capacity. So that's been, I think, a silver lining of this COVID-19 cloud, is that we're really learning to adapt and to provide care in new ways and novel ways. So we're using a lot of triaging of patients to staying at home who have really mild symptoms, and if people have serious symptoms, or if they're very high risk for disease progression, like people who are of advanced age or have certain conditions like immunosuppression, those patients we might bring in for a test. Or if the symptoms progress, we would bring in for a test. So again, talking to your healthcare providers that you know and trust is the best way forward when you're feeling symptomatic.
Can I just echo something that he said? I think probably the most important message there is that please call first. So unless you're experiencing a true emergency, please call first before you're coming in, so that you can get the proper advice, because many times we are asking people to stay at home and monitor their symptoms at home so that we don't flood the emergency departments, and so people don't come into contact with other people that are ill. So I think one of the most important things is to call your primary care provider or call one of the clinics to talk through your symptoms first and see what your next steps should be.
And as Dr. Goldman mentioned, and Kate, probably Dr. Mandel, what you've mentioned in regards to your clinic, we can connect so many more people now virtually, where we can get those things done where you don't feel that you need to leave your house or come into a place where you may feel unsafe or you may feel not protected. So we have those capabilities. We have had those. Those are ramping up hourly, I would say, in regards to that capability. So please, there's a lot of ways to connect with us, and we are here for you.
And we also have community response clinics that we've set up, which are kind of the drive-throughs, as they've been known as. And so that's all on our website, where you could check on the locations and the hours if you just have to get out and just need to know. Because the question too is, if I have these symptoms, should I just hunker down and stay at home? And do I need to get tested?
Yeah. No, I don't think we're advising people to really be isolated and not call attention to their suffering and their symptoms. What we want to do is to talk to people, and talk to them over the phone is probably the best way first. I've been calling my patients on the phone since the beginning of this, and really I can get quite a lot of information by talking to someone, and we can really ask questions, hear about the symptoms, and make the best next recommendations. I did my first video conferencing appointments this week, so that is scaling up, and what I can say is my patients love the experience.
Good.
I got really warm feedback. It's actually very personal, and patients can be in the comfort of their own home and not have to travel sometimes long distances like our patients are used to seeing.
And I'm going to take a question. Thank you. I'm going to take a question from one of the folks on Facebook. Is there still a shortage of test kits?
Yeah, I can address that. I think that testing bottleneck has really reduced substantially. I think we have the capacity to test certain types of persons. So for instance, patients who are really sick all can get a test now within 24 hours. Patients who are mildly symptomatic, if everyone came in for a test, it might overwhelm the testing infrastructure. So that's where we're trying to encourage people to call into their clinic and talk to their healthcare providers to get an idea if their symptoms are serious enough or if the person is high enough risk to demand a test. There is not enough testing right now to just test everybody. There's been lots of discussions in the national media, healthcare economists and others. We're not at that point yet, but hopefully, we'll get there.
The other question I've seen out there a lot is, what about at the grocery store? I mean, do we need to be worried about coronavirus there? And how about the packages that we're shipping into our homes every day? Like, what kind of care and attention needs to be focused on that?
I mean, I think the same as we've been messaging, washing your hands frequently and often before the grocery store, gelling in the grocery store, washing your hands after you leave the grocery store, trying not to touch your hands to your face, nose, and mouth while you're walking through the aisles, and then not picking up everything in the grocery store. So try to only pick up the things that you need. I know some people are also not using the reusable bags that we pushed so hard for so long in Seattle, but have sort of switched back to paper bags for this temporary period.
What's interesting, what I've seen, and those of you who've been in the grocery store have seen this too. A lot of grocery stores now have the wipes when you go in. So take the wipes, wipe off the handle of the carts, things like that, throw it away responsibly. And then with the checkout lines, you see them put X's on the floor where you can maintain that physical distancing. So I think, and I've seen this in a lot of places of the businesses that are still open, everybody's taking this seriously and everybody's doing their part. And so again, we see other businesses doing their part. We're all doing ours, and I'm quite thankful for the people here today. But I can't overemphasize it. Your part means a lot too, so thank you for that.
Yes.
I can just add on a little bit more to that, Mona. I think what we know about this virus is that it does get spread by droplets. So when someone sneezes or coughs is when it spreads. That's the primary dominant mode, but it also touches surfaces. So we heard Dr. Mandel and Dr. Hudson talking a lot about touching of surfaces and touching your face. You don't want to allow your hands to touch your face. You don't want to touch things that aren't necessary. And surfaces in high-use areas like in the hospital, we're doing extensive wiping down to remove some of that of the virus that can be on surfaces.
Constantly.
Yeah, constantly, over and over, almost hourly, high-touch surfaces are being wiped down. And these are the ways, in addition to physical distancing, which we can really help to mitigate the epidemic and keep it at a sustainable level where our healthcare systems can take care of people who are sick from this.
Thank you. And I would say we're actually at Swedish are adopting a physical distancing for social distancing, because psychologically, for the well-being and mental health of folks, we don't want to say it's the antisocial. We want to say it's actually the physical distancing.
Well, humans
of 6
are
feet.
social beings. Right?
Exactly.
Physical,
I think it's been somewhat enjoyable, all the Zoom meetings and online yoga classes and other things that are popping up all over Seattle. So
It's a whole new way of doing things.
Seattle's a city that can adapt quickly.
kids
That's true.
FaceTiming each other
That's
constantly.
right. That's right.
So I have a question here. I am a 76-year-old and I have had bronchitis as a child. Does that mean I'm higher at risk?
Do you want to take this, Dr. Mandel? Or?
Sure. Well, I would say we know that by age, that puts you in a slightly higher risk category. More elderly folks have a slightly higher risk of being at risk from this process. Having underlying lung disease can also potentially put you at higher risk. So generally the CDC and the WHO have been recommending, particularly people with underlying comorbidities or underlying diseases and elderly, take a special care to maintain that physical distance.
Yeah, and I'm getting a lot of questions from my patients, from my family, from my friends. I've paid special focus to my own parents and forced them to stay home. I feel very strongly about that. My parents are in their 70s also, and are in good health. But like Dr. Mandel said, they are at higher risk of progression from COVID. So there might be ways to convince people who might not be taking this seriously, the physical distancing part of it, to figure out ways to really do that, because that's probably the best way to protect yourself as well as helping mitigate the epidemic.
I know my parents, I have children, they've wanted to come and help. They know I'm working a lot, all these things, and I've had to say, no, that's not appropriate. But they actually have been doing a great job. They FaceTime and read stories to my kids every day, which is actually quite a relief for me. So that's been very helpful.
That's great.
What about pregnant women? I mean, we've heard that a lot. If I'm pregnant, how do I handle this?
Yeah, great question, Mona. Pregnant women do have some immunocompromise. That's part of the normal physiology of pregnancy. And in certain other times of other respiratory viruses, pregnant women seem to be a little bit more at risk. I remember in 2009, when I was doing my training, that was a significant issue with the influenza epidemic that year. It doesn't seem that this novel coronavirus has as much effect on pregnant women this time. So there are some recommendations that our colleagues in OBGYN and midwifery are recommending to their patients. Guidelines might differ a little bit between the CDC and the World Health Organization. Our providers at Swedish, who I talked with before this meeting, are going with the CDC guidelines, which recommend that pregnant mothers separate from their children for the first 14 days if the pregnant woman is COVID positive. But if the mother doesn't want to do that, recommend wearing a mask while breastfeeding. And luckily, babies don't seem to be too susceptible to COVID-19, so that's a real bright spot. And importantly, there's been no documented transmissions from mother to child or vertical transmission.
That's great news.
Or through breast milk as well. Although, data is limited, but.
Yeah, no, that's great news. We have a question here that says, how many patients in Swedish with COVID in the ICU, and what is the predicted surge? I think that's an interesting thing about the surge, and we touched on that a little bit earlier. Anyone?
I don't know if we're allowed to say how many patients are on our campuses. Dr. Huxton, do you want to?
Well, what we can do is talk about how filled are our ICUs, how are we doing as a system?
So we have people come in daily that have testing, that meet the criteria for testing. I will say that we do have capacity in our hospitals as well as our intensive care units. And the volume has been in the past 10 days steady in our ICUs in regards to those needing intensive care. So again, when we talk about the plateau, and as I talk to other healthcare CEOs around our neighbors and those around the Puget Sound, we have done specific measures to make sure that if we do see an increase in the sick in the Puget Sound, that we have the capabilities to take care of them. And again, knock on wood, it's been relatively steady or a very slow rise. But yes, we do take care of COVID patients, but it is definitely not the majority of what we're seeing now. Most people in our hospitals are COVID negative or do not have the symptoms that require testing, which is we're thankful for.
And there's a question here that says, are we expecting still a 2 to 3-fold increase in patients since the numbers are slowing down? And I really want us to touch a little bit on surge planning, because I think most people aren't privy to this, the fact that when COVID kind of hit Seattle, our experts were heads down and really planning for any type of surge. So I don't know if you want to touch on this.
Yeah, well, it's interesting, given the fact that the first case was in the state of Washington. We couldn't turn to United States data or experts really that where it's occurred and elsewhere in the United States. So we had to turn to international colleagues in regards to understanding the disease progression and what we could expect in our geographic area. And that's where, my colleagues here have done an outstanding job of those open networks of like physicians in other areas. And we've gotten to really kind of understand it a little bit better in regards to how it's distributed in our geography, how different geographies make a difference in regarding spread. For example, New York versus what we're seeing in Seattle, and what mitigation strategies actually work to slow it down. The countries that started first really did not do the physical distancing or social distancing, and they saw a rapid rate of rise, and it escalated very quickly. Based on those learnings and what all of you are doing with your physical distancing right now, we have the power to slow this down. And we've seen it in the state of Washington, and again, that's the most important thing that we've seen, and that's just based on learnings that other governors and elected officials in other states have mimicked and copied in regards to, we know it works, so it does make a difference.
And here's a question that's kind of in general that keeps coming up, is really about supplies. How are we doing on supplies?
Well, I would really like Dr. Mandel's answer on this too, but supplies, there was an article that came out the other day that was, how could the richest country in the world not have enough 75-cent masks? And I would be completely honest with you, there were a lot of supply that we were getting from international sources when there were issues regarding the spread of coronavirus in those countries that kind of shut down a lot of the supply chains. And so the United States has been increasing manufacturing to keep up or get us the supplies we need. And again, as the WHO and the CDC guidelines mature, as this disease progresses, especially those here in the room have seen different guidelines mature based on the understanding of the spread of coronavirus and what people need to do to protect themselves. And do we have those supplies on hand to do that? I will say that this is a multifactorial answer. So we diversify our supply chains to make sure, one, our caregivers are safe, and two, if one supply chain proves not to be reliable, we have other equipment, masks, and other things coming in from other areas. So we have a lot of different sources, from companies that have shifted manufacturing into supplies, to those that are beefing up supplies, to those volunteers who are actually making supplies for us, or we just got a very generous donation from a company out of San Francisco that just supplied masks for us that will last at least a month. So everyone's stepping up into this fray. But again, the most important thing, and I'm turning to Dr. Mandel, is how are the caregivers doing? How are you doing in your job? And are you getting what you need to make sure that you stay safe and that your patients are well cared for?
So I think it's been a very stressful time for everybody that's been working on the front lines. As these guidelines mature, it's a lot of changes. People want to know that they're always doing the most safe thing for themselves and for their family, and that sometimes has been a challenge as these guidelines have changed or matured over time. There have been at least thoughts of shortages, or we know that things are potentially going into low supply and not sure when the next shipment is coming, so there's been uncertainty there. But things are getting better. The speedier turnaround for testing has actually made things a lot better, because now we can rule people out faster, which frees up a lot more of that personal protective equipment. So we're using it on people where we need it and not on people where we don't need it. So that's been very helpful. And the community, in terms of the whole country's engagement in this process and trying to basically help in any way they can, has been great as well. So we would all like to be fully shielded from head to toe as best we can, to prevent anybody from having to contract coronavirus at work or elsewhere. And I think we're all trying to work within the limitations that we have, knowing that lots of people need this equipment, and we have to make sure that everybody has it available to them.
Yeah. And I think, just to add on what you're saying, Dr. Mandel, it's not just all about masks and other personal and protective equipment. We've had really supply shortages in all areas of the resources needed to take care of COVID-19, whether it's from test reagents or the test kits themselves, the swabs, and lots of other things. You might have heard about the run in the pharmacies on the drug Plaquenil or hydroxychloroquine. That's a rheumatoid arthritis drug or anti-malarial drug. and it appears like it may have some efficacy, at least in the petri dish, against the SARS coronavirus 2. So there's been a run on that as well. And it can be prescribed off-label use, so some doctors are doing that, but there's really not enough to go around. So we're, at Swedish, we're just trying to figure out how to do that rationally and logically and try to save it for the people who might be able to benefit from it most.
Yeah, and what's amazing has been the public outpouring of donations of masks, equipment, and things like that. And so we have a few questions on this here, and what we'll do is we'll post our website that has the guidelines around where you should be donating if you want to help out. So we want to thank you for that. We're quickly drawing down on our time, so I wanted to do a round robin real quick on what's your best advice for the folks out there. So should we start with Dr. Mandel?
Stay home. As Governor said, physical distancing, you're staying at home, washing your hands. I think that's where everybody can pitch in the most.
I agree with what Dr. Mandel said. That is the most critical thing that you can do to help keep yourself safe, your family safe, and actually help us do our jobs in regards to taking care of those who really need to see us in our healthcare system. So thank you for that.
Can I add one thing?
Sure.
I would invite people to just take one long, slow breath a day. I think everybody, the more that we can remember that we're all in this together, the better off we'll all be.
Yep. I take 10. Yep.
Dr. Goldman?
Yeah, I'd reiterate about the hand washing is
Actually,
so
they told me
important. The physical distancing is so important. And I think also connecting with each other in ways that we can and helping each other out. I think in the medical profession, that's what we do. We got into this to help people. I think we can all help each other out, whether it's taking the garbage down from the front of the house for your elderly neighbor or checking in by Facebook with your parents or other loved ones. I think we really need to stay connected, even if we're physically distanced.
I would agree and echo
Well
that
said.
because of all the anxiety that's created for staying home to stay healthy. I know that that's difficult for people, especially in the Pacific Northwest, where we love the outdoors and being out there. So with that note, I want to thank you for joining us on this week's Facebook Live. We're going to try to do this as a weekly live so that you can continue to think about your questions and ask them, and the ones we didn't get to, we'll try to answer. So thank you very much.
Thank you.
Thank you.
Thanks.